Dr. Pavlakis, sometimes kids get seizures without fever, and it's called epilepsy. What is epilepsy?
Well, epilepsy is usually defined as having more than one seizure, such as two, in a child that does not have a fever, that does not have so-called febrile seizures. In children, epilepsy is very common, and in fact, 50% of all people that have epilepsy are children under age 10. The key thing to know is just because one has a seizure, even if it's without fever, in children under age 10, it's generally not anything serious, in most cases, and it's not usually associated with lesions in the brain, and it's not usually associated with a bad course. Indeed, the majority, 60% of children that have epilepsy under age 10 will in fact outgrow it by the time they're 10 or 12. So for most kids, it's not a huge problem.
In the newborn nursery, a young child gets a low blood sugar and sometimes shakes, maybe has a seizure. Is that a real major problem down the road?
Well, low sugar, which is very uncommon in children unless they're pre-diabetic, and except for some very, very rare diseases, is seen more commonly in the newborn period. Having a low sugar at one time that's transient is probably not a major problem. However, if there is a low sugar in the newborn period that happens more than once or twice, it can actually cause long-term problems, including learning disabilities and the continuation of epilepsy.
What about if the child was born with a low calcium and gets tremors and maybe a seizure? Is that a problem too?
Low calcium generally doesn't cause a prolonged problem. So it's usually not a long-term problem for the baby in terms of the neurological status.
There are different types of epilepsy. There's one with rapid eye movement, there's someone staring. What's the difference of these different types of epilepsy or seizure disorders?
The way we break up seizure disorders or epilepsies, meaning you've had more than one seizure, is usually break them into two types. Generalized, meaning that the electrical discharge comes from both sides of the brain, and focal, or what's called partial, which means that the electrical discharge is coming from one part of the brain. And they're broken down into different clinical types that sort of tell us where the electrical discharge is coming. The key thing to know is that a lot of children have epilepsies, whether they're partial or generalized, that are benign, that we can actually call them good kinds of epilepsies where we know that they will be outgrown, sometimes even to the rate of 100%. And some of these will start in infancy, some will start later on, and we can actually, by the clinical course and by the EEG, tell one if it's going to have a good course. Unfortunately, conversely, there are certain seizure types, especially in infancy, that are bad, that have a very bad course, and that too can typically be told by the story, what the seizure looks like, and by the EEG test, which looks at the electrical activity of the brain, and there are certain patterns that are worse for outcome of development and for the ongoing possibility of epilepsy.
If my child is put on medicine for seizures appropriately, does that mean forever?
No, as we said before, that many epilepsies are outgrown. And typically, if a child comes in who is normal, has several seizures, and is put on medication, we typically treat for sometimes only a year, possibly 2 years, and this is in the older child over age 1 year. And we will take it off and see if there are any further seizures, because a lot of these children actually, as we said, outgrow their predisposition to epilepsy.
I noticed when I applied for a driver's license, the question was there, do I have a seizure disorder? Does that mean I can't now drive a car?
No, in New York State and in New Jersey, actually, even if you've had a seizure disorder in the past or epilepsy, you can drive a car as long as you've not had a seizure for a year, whether it be on medicine or off medicine. You typically need to go to a neurologist, which is the only difficulty with that you just have to go see the neurologist, and typically within 120 days of signing the form, and the neurologist will say that you've not had a seizure and you are able to drive on their letterhead.
Some kids have staring spells and they go to a neurologist and they say the kid might have a seizure. What's that all about?
Well, staring spells usually actually are not seizures. It's more often than not daydreaming. But a staring spell can be a seizure. If a child loses their focus when they're doing something and stares off into space, that can be a seizure. And there are children, for example, who may have multiple staring spells where they change their level of consciousness every day, and that is a manifestation of epilepsy.
What do they call that?
Well, there are different kinds of epilepsies that can have staring spells, but the most common one that everybody knows about is what people call petit mal. The more current term, which is actually already 15 or 20 years old, is absence epilepsy. And this is a form of seizures that occur in normal children between the ages of 4 and 12. And they usually present around 4 or 5 with multiple staring spells a day, but they're otherwise perfectly normal. When we do the brainwave test, the EEG, we see a certain pattern that fits petit mal or absence epilepsy, and this allows us to diagnose it. With that diagnosis, we can tell the parents that the child generally will do very well, that most of these children, again, roughly 60 to 70%, will actually outgrow their predisposition to seizures. And we also, furthermore, will know what medications we could consider using that would stop the seizures at that time that would be more efficacious than other medications.
If a kid had a head injury and had a seizure in the first week, is that a bad prognosis or a good prognosis?
It's actually neither. It doesn't really affect the outcome. Certainly, children can actually hit their heads and have a seizure at the time of impact, and we don't think that means anything whatsoever. It's actually more common in children for them to have a seizure.
It's called an impact seizure?
It's called an impact seizure, and that really has no implications. Doesn't mean anything bad happened. Doesn't mean the child will do badly. We also, from what data we do have, that if a seizure is related to head trauma, which again is pretty rare, but if it happens within the first week or two after head trauma, it doesn't seem to have a very poor, or I should say, it doesn't seem to affect what happens in the long term terribly much. Clearly, if it happens further and further out from head trauma, that would be more concerning, but something that happens around the time of head trauma probably has very little concern to us as neurologists in terms of the development of epilepsy or in regard to any issues in terms of brain damage.
Today we have a lot of medicine that can treat seizures. There's a very good chance we can control many of the seizures we couldn't in the past. Is that true?
Well, it's interesting. We can control about 80% of patients with epilepsy. I actually think we control a little bit better than that, but the numbers are about 80%. We have a lot of new medications, and we do very well, but it's not clear that we do much better than 80%, and that's what we did back in 1990 as well. So we are better. We have medications that have less and less side effects and don't affect lifestyle or such. But we have had a hard time getting above that 80 to 90% mark. But again, I think I want to stress the issue that that's somewhere where research has to go. But most children that have epilepsy are very easy to treat, or they outgrow their seizures. The vast majority. So we're talking about a small group that has difficult to control epilepsy.
Thank you very much.